Welcome everyone. If you are looking to freshen up your look with facial rejuvenation and you're ready to make that first appointment, but you really aren't sure what to expect, we're going to actually walk you through it today with Danielle Moser with Maloney Plastic Surgery and Skincare. Danielle, thanks so much for coming back.
Thank you. Thank you for having me.
I love that we're going to do this because I'm sure people aren't sure what to expect, what you're going to cover, and we're going to kind of walk you very easily through that, starting with the first meeting, right?
Yes, so when a patient first comes to see me, and sometimes they're just inquiring about cost and the way the procedure will work, we take you back. We do a photograph that includes 3D imaging so we can follow your treatment over time and see how you're progressing. And then I let the patient tell me what brings them in and what they're concerned about. And as I'm listening to them, I'm also watching how they're animating. I'm watching how their brows are moving. I'm looking for little fine lines or discolorations on the skin. And I'm thinking about volume of the skin, if there's volume loss or if they're sagging in an area as they're talking to me. So I can see both dynamic movement of the face and also address static lines. And I'm listening to what they're asking me for, but I'm also kind of thinking in my mind, how can I make this person look like a more well-rested version of themselves?
And I love that you're saying while they're talking and telling you things that you're looking at everything. This isn't just maybe just a line here or something. You really are looking at the whole picture.
Right, and that is the sign that you're kind of in the right place.
Yeah.
The person that's going to be injecting you or doing a chemical peel or a laser procedure, they should be looking at your face as a whole. They should be looking for symmetry, the way that the light reflects on the skin, so that they can come up with a plan for your future. You may be doing some of it that day or in the near future, but they'll kind of mark that out for you so you can see what your treatment course would look like over time.
We're talking about being in good hands. You're the good hands. You do a wonderful job. On top of, even before we get to that first appointment, is there anything that I should bring with me?
Yes, I'd love it if you were on any products, topical products, if you brought those with you so we could kind of see what you're on and address if that's the best treatment going forward. I might add to it, or I might actually take some products away because I like a very concise treatment that's tailored to the individual, and I'd like as few products as possible for maximum results. So we kind of look through your products. And also I love when patients bring an old photograph with them, usually from 10 or 20 years earlier, so I can assess volume loss and look at how your face looked when you were happy with your appearance, and we can try to bring you back to that point in time. And so here we're looking at some photos of a mother and daughter, and we can see the changes over time. We see that light doesn't reflect quite the same on the skin. We see some hollowing out under the eyes. The brows drop down ever so slightly. There's some depth around the nose and mouth, and the corners of the mouth start to turn down. And in this photo, we're seeing the underlying fat starts to thin out and descend also. And as that happens, we get that heavier look at the jawline, and it pulls the corners of the mouth down, and it contributes to that hollowing under the eyes. The eye actually gets a little bigger as we age. And these are things that we can address with fillers and Botox, and sometimes it can't actually be helped with fillers or Botox, and we discuss plastic surgery and if that's an option for you.
And I love that it's all in one office, so whatever the right thing is for you. And I love that you guys are always, everything is personalized per what you want, your facial features. You guys will go through the right treatment options. When on a consultation, how long does that usually take to go through?
Usually we have you in the office for about an hour, and
okay.
I go over everything with you. We take those initial photographs, and then we write out the entire treatment plan. I like to handwrite it so that it's tailored for each patient, and we can make little changes as we go along and go over all of your products, any medications that you might be on, and discuss when and where we'd like to do treatment.
Is there a cost?
It's $135 for that initial consultation. It can be waived if you do treatment that same day.
And actually, that was going to be my next question is, if we're already ready and set to go, can we do treatment that day?
Absolutely. So generally when you call to make your appointment, the receptionist will ask you if you're considering treatment that same day. And if you are, we just extend the appointment time ever so slightly so that we might incorporate that.
And again, before we come in, we know what to expect. We could get a treatment if that is something we want to do. Is there anything I should know to do or don't do before coming in?
please, if you're going to consider having treatment that day, you want to avoid any sun exposure right beforehand, just in case we do a chemical peel or a laser treatment. And also, you would want to avoid any aspirin or ibuprofen products and fish oils, because those can contribute to thinning out the blood and therefore bruising if we're going to inject that day.
We are really getting everybody ready for this first consultation. But before I let you go, Danielle, I know we've had you on before, but let's remind everybody what your specific qualifications are, so everyone, again, feels like they're in the right hands.
Thank you. Well, I've been a board-certified physician assistant for 20 years, and 16 of those years have been in the cosmetic industry. So I've been around since the beginning of time in this industry, basically. So 16 years ago, when I first started injecting, Botox was not yet FDA approved and on the U.S. market. We just had the old-fashioned collagen where you'd kind of come in, get a skin test, and maybe we could treat you 2 weeks later if you didn't have any reaction to it. So nowadays, everything kind of moves along a lot more quickly, and we've been able to watch how all of these products transpire and progress over time. So I'm very used to using different products in different areas depending on what might be best for the individual.
And again, we're back to that, in the right hands, a great staff there, great office, and I'm going to remind them that you guys actually have a special going on right now. But thank you so much for coming in.
Thanks for having me.
This is going to make everyone feel so much more ready for that first appointment. And we have that special. If you schedule a consultation in the month of July, you will get the normal $135 consultation fee completely waived. Call 520-298-2330 right now to make that appointment, or for more information, log on to acssurgeons.com.